Well, good morning, everyone, and welcome to our roundtable discussion. Our roundtable discussion for today is entitled Healthy Kids for Our Future. What a great topic. My name is Russell Ray. I'm the editor of the Journal-Record. And first and foremost, we need to thank our presenting sponsor, Cigna Health and Life Insurance, for making this very important discussion possible today. And actually joining me in moderating this morning's discussion is Autumn Zane. Autumn is the Chief Operating Officer for the North Texas and Oklahoma region for Cigna Health and Life. Our discussion today will focus on how business and education can help provide for the health needs of Oklahoma students. And joining us to discuss these very important issues are experts who can talk in great detail about the efforts and challenges in promoting and achieving healthy behaviors. Joining me today are, we'll start from my immediate left, is Dr. T. Craig Cupich of Integris Family Care Edmond East. Thank you for joining us, Doctor. Gary Cox, Executive Director of the Oklahoma City County Health Department. Thanks for being here, Gary. Mary Malone, President and CEO of the Foundation for Oklahoma City Public Schools. Thank you for being here, Mary. And Dr. Sean McDaniel, Superintendent of Oklahoma City Public Schools. If you'll please take a moment and join me in thanking our panel for their very valuable time today. So with that, I'll hand it over to Autumn for a few words and our first question.
Great, thank you so much, and thank you so much for being here today. This is a really important initiative for all of us within the community and within the city of Oklahoma City. Recently, Cigna announced a national program, Healthier Kids for Our Future, to largely focus on reducing childhood hunger as well as improving nutrition. But if we wrap that and encompass that in our overall mission of addressing health, both body and mind, we thought today would be just a great opportunity for us to talk about some of the things that are challenging our kids and our students within the community, both from a holistic viewpoint, from a physical and a mental standpoint. And our first question probably goes best to at least start from Dr. Cupich, and it is, what role does the family physician or pediatrician play in our children's lives, both for physical and mental well-being?
You know, that's a very interesting question, in that I think the answer to that question has changed over the past few decades. I'm a relatively young individual, I like to think so, but when I was a kid, I would go to the doctor only when I was sick. I would go to the doctor for vaccines, and so at early childhood, very, very young age, you'd go to the doctor very frequently, get your vaccines, and then there would be a period of time where you didn't see a doctor unless you were sick. Nowadays, the pressure is on both educators and physicians that the health of our children is really in your hands. From a accountability standpoint, I work for Integris, which is a hospital-based group, and I'm held to standards for vaccination rates, for well-child visits. The responsibility is in my hands for the overall development of the child. Many of those factors I can intervene on. Many of those factors are outside of my control, but I have to make an effort to intervene on. Childhood hunger, so socioeconomic status, background, their access to food. Vaccination rates certainly play a role, like we discussed, but the development of the child overall is in the hands of the physician, where 15, 20 years ago it wasn't as much as it is today. And I think that's an important thing. The pressure is on in our communities to raise healthier children because we have so many challenges going on in the community that we didn't necessarily have 10 and 15 years ago even.
So on that note, both being on the physician, what role does the school have?
Well, I was just sitting here listening to the response, and that could have been my response. You know, education has changed drastically over the last few decades, certainly in the last 10 years, where our focus is not only being the content expert in the school, math, reading, science, etc., but we pay a lot of attention to meeting the needs and filling in gaps for our kids, whatever that looks like. And so I'm grateful for that response. I look at the doctor, whether it's pediatrician or an eye doctor or et cetera, any service provider, mental health provider, as a teammate of ours, so that we have this this beautiful kid who comes to us with all the challenges, and we communicate with each other. This is the ideal. We connect with each other, and we take care of these kids. With the thought being, unless we can take care of those fundamental needs that our kids come to us with, we can't get to the top of the pyramid. We can't get to academic success for a lot of our kids.
Gary, Mary, do you have anything else to add to that?
Well, I think it's important to paint the picture, especially for those who aren't very close to the reality that so many of our kids face. And the picture for our kids in Oklahoma City Public Schools is dire in so many ways. We've got 45,000 children. About 90% of our kids live at or below the poverty line. So that means that they're coming to the classroom, like Sean said, with all these issues before they even get to their spelling test. So you have a child that comes in who hasn't eaten since the night before or since they left school the day before, who may have clothes that aren't clean, who may have witnessed some trauma the night before, who may have a family member who's incarcerated, who all of these things. And we have so many stories, and I think it's really important to understand the stories of these children. I was just at Adams Elementary School doing a community partner event the other night, and the principal was sharing a story about this child had shoes that were completely falling apart. And so the teacher came in, brought these tattered, falling apart shoes and said, "Do you have any duct tape? Because he can't keep going in these shoes." So the principal said, "Well, I have some duct tape, but let's go look in our clothes closet." And a clothes closet that was helped and supported by a community partner, they found one pair of boys' shoes, one pair. And lo and behold, it happened to be a size that was going to work for this child. And so they went back to the child and said, "Okay, we can duct tape your shoes, or you could have these new ones if you want these new ones." And she described the joy that this child felt at being able to have a pair of new shoes, where most of our children would only get that excited about having a new toy that they'd been waiting for a long time. But this child had the opportunity for a pair of new shoes, and it completely filled this little boy with joy. So that's the reality of our kids, and I think that's important before we get to anything else, is to remember these are real kids with real stories.
That is a great story. Gary?
Yeah, I think, as others have mentioned here today, there have been a lot of changes in education and healthcare in the last 10 years, and I think the same thing is true of public health. You know, we have a great medical system here in Oklahoma, and what we have done, and so we have that, and so what we've really done now is we focus more on, in addition to sick care, we focus more on wellness and prevention, because in that realm is where we can have a lot of opportunity to save money, save health costs, save people's lives, and so on. And so also we begin to think more in public health about how do you pull together partnerships, private-public partnerships, to really be more effective and be more effective at what we do. And we're beginning to look at things as important as what happens in the doctor's office is, and it's very important. We begin to look at also behavioral health and also some of the things that happen outside of the doctor's office that are really big influencers on health. And Mary kind of alluded to the fact of housing, because a lot of kids in the system don't have housing, transportation, food insecurity, interpersonal violence, things such as that really affect health and are not only going to affect health, but are also going to affect educational attainment as well.
Let's take some time to talk about the peer influence factor. And what I mean by that is peer pressure, bullying, loneliness, social media, those types of influences. How has the peer influence factor impacted the physical and emotional health of children in our communities? Has it been good? Has it been bad?
Well, I'll jump in on that one. Peer pressure, whether positive or negative, is highly contagious. It's kind of like good news, bad news. We know which news travels fastest. It's always bad news. And the same, my experience is that bad behaviors are more highly contagious. So when kids come to us with the many challenges they have, if we don't understand what we're seeing, if we can't identify the root of the behavior and then treat it, acknowledge it, bring in trained adults who understand what this is, then that challenge turns into, in many cases, a behavioral issue, a discipline issue, and kid behaviors change. And I think the good news is we have really started down a good path for some time with this connectivity I was talking about, where we do have partners. We would like to think in education that we're the experts in everything, but we're not. And we need other experts to come help us so that we know what's going on in the life of a kid. We can address it, and then those positive behaviors follow, which are also contagious. So I think peer pressure is like it's always been. For whatever reason, kids are attracted to particular behaviors. It's our job as community partners, as educators, to do a really good job of identifying what's going on here and then addressing that.
Mary, you got any thoughts on that?
Well, I'm not an expert in peer pressure, although I know it's there. And so what we try to focus on at the foundation, and I'll tell another story, is to try to create positive behavior. And we launched an effort at the beginning of the school year to incentivize our kids and get them excited and motivated about going to school as high schoolers, because we know that we're losing them. We're losing them. And so we put together a campaign called Driving Attendance. And day after tomorrow, we're going to be giving a student a brand new free car who is being recognized for having really great attendance. We've been tracking attendance all through the school year. A student gets a chance every 9 weeks to go into the drawing, and so then we've pulled randomly 10 finalists. One of those 10 kids will be have the key that starts the car on Saturday. So what I've personally learned through this is in interacting with these kids, and then this week interacting with their parents, because they've had to sign agreements and prove eligibility and all of that kind of stuff. And I had a conversation with a mom whose son is a finalist. They both work at Taco Bell. They had to work to get off of work Saturday to even be there. But she shared with me, he decided the first day of school when he learned about this driving attendance campaign that he was going to work for it. And he set his mind on it, and he made a goal. And, he was competing with thousands of kids from all of our high schools, but he made it into the top 10. And he did that just with grit and deciding that he had a goal and that his behavior was going to be positive.
What a great story. I want to buy cars for all 10 of them.
I do too. I know. It's already killing me. I'm rooting for all of them.
Dr. Gubick, anything to add? Or Gary?
I think it's really neat to hear these positive stories of peer pressure, and I'm glad that we have programs like that. I would say on a day-to-day basis, most of the stories aren't quite as positive, and that's the hard part of this. Probably 1/3 of the patients that I see in my office, the adolescent patients, so 12 to 18, 1/3 of these patients are struggling in a social element of their life with their peers in some capacity. Every single adolescent visit, child check, that pediatrician, that family doctor is asking them about those social relationships because it affects their overall health. It affects the young teenage girl that's coming in with abdominal pain that nobody can seem to find the source. It affects the young boy that has headaches every single day that he's got a test because his school performance hasn't been as good, or he's being tested for a learning disability, whatever is going on. The point is that these social interactions are directly affecting school performance. School performance is tied in with physical health, overall well-being, and I don't think anybody has the answer. It would have been solved 5-10 years ago. The other challenge I think that we're facing right now is these novel agents that we haven't had 5 and 10 years ago, specifically with respect to substances and substance abuse disorders. And I'm speaking about even things as considerably benign as what people would say they're benign, e-cigarettes, Juuls. Peer pressure is playing a huge role in this. This is a status symbol and an element in a certain respect in these schools. And it's harmful overall health. There's a lot of misnomers. There's a lot of misinformation out there. And I'm disheartened, I guess, and I'm saddened. I mean, as a pediatrician, it really breaks my heart to see the challenges that these kiddos are facing. Back to your first question about who's playing a role, the educator's role in the health care of a child is fundamental. And parents are the experts on their children, yes, but when a parent doesn't have the knowledge to know when things are right and when things are wrong, when their child is well and when their child is sick, that teacher has seen thousands of kids come through the door. Whether they know the process, the disease process that's taking place, they know whether something is right or it feels wrong. They're a point of contact for a local physician, and I want to really address any educator that's listening right now. Please feel free to contact your student's physician, your healthcare provider. They're not going to provide healthcare information about that patient to you, but you can always report your concern about an overall wellness of that child, the illness that's going on in the classroom. That's more evidence for the physician that they would not have otherwise, and it's essential. Peers, even if a student or a friend is listening to these sorts of things, that's a valuable source of information that the doctor can use to address the overall health care needs of that child.
So totally agree with that. One of the things we talked about, or that I mentioned earlier, was getting away from just being content experts as teachers. And so one of the things we've identified, because of the different challenges our kids come to school with, and empowering a teacher with that ability to see it, we have stepped into trauma-informed training as an example, so that I'm not just relying on my gut, which, I mean, you all have had teachers. Teachers are really good at relying on their gut, but this takes us to another level where we're identifying for them through training specific things to look for, specific behaviors, specific responses to pretty easy questions. And this is off, and they understand that not gut level only, but through very specific, effective, high-level training that we're going to be providing. In fact, we've already begun that process. The other thing, just to piggyback on what you said, is acknowledging as a group of educators that our job is different. There is a tug of war that still exists between and amongst educators on the purpose of being an educator. Why are we here? It's to teach kids. No, it's not just to teach kids, it's to take care of kids. And unless we can move over on the continuum to the let's take care of kids, we're going to continue to struggle with these types of things. And I'm very encouraged, and glass half full, I guess. I know the challenges, and we see it every single day. But we have a pathway, we have plans, we have great partners who say we want to link arms with the school district and do more of the taking care of kids. And I think that gives us hope that we can change trajectories for our students.
I think not too long after Superintendent McDaniel came to Oklahoma City Public Schools, and he's shown some excellent leadership. We had a discussion, and I part of that conversation, I asked him, I said, you know, because we see the link between education and health. If you have good health and you're able to go to school, you're more likely to graduate from high school. And if you have also good health, I mean, you can actually go to school. The same token, if you graduate from high school, your health is going to be better. And so there's a strong connection there. So I said, Sean, what would be one of your biggest needs? And he said, after-school programming would be one of our biggest needs. And so we kind of had some more discussions and followed up on that, and had the opportunity with the school repurposings to take the lead in 2 of the schools that are going to be repurposed in high-need areas of our city, to really provide some programming that's going to meet some of the needs that some of these kids may not be able to have at home. But also be fun too, but it'll be mentoring opportunities and some tutoring opportunities, maybe even probably have some food there for those that might need that. Have folks there that can link them to services in the community. Some of our staff can do that, as well as to have medical care, behavioral health, counseling care, and then some of the fun stuff too, like soccer fields and community gardens, walking trails, and all of that, basketball courts, so that the kids could come and their families can come there and get a wide range of services, and opportunity to be physically active, because that's going to be a big part in their self-esteem and being able to resist bullying and other dangers that there may be there.
So if we take that question a little bit further, identifying health disparities in local communities has become a large part of overall community health discussion really across the nation. Can you tell us what we're doing here in Oklahoma City to address the disparities of our children?
It's a major problem here in Oklahoma County. We do community health assessments and zip code by zip code. And what we found is that if you compare the lifespan of the most healthy zip code with the most unhealthy zip code, there's an 18-year gap in life expectancy in Oklahoma County. And so that just means that a child that's born in one zip code, just because of where they are born, may be subject or may not have the opportunity to live a long life, as some of the areas that have other opportunities. And so that's one of our major goals, is to try to narrow and eliminate those disparities. All kids and all families really should have the same start and the same opportunities. And so we're trying to get that word out to our community, because the first part of it is awareness. A lot of people just don't know. But after the awareness, then it comes, okay, that's unacceptable. Let's come together as a community and see what we can do about it. Let's partner and bring resources to those areas, in targeted resources. And actually, 2 of the schools that we've actually targeted, that's exactly why we were interested in them, because they're in areas, one of them is just very close to the area where there's an 18-year gap. And so we need the community to come together, private-public partnerships, and really say this is going to be a priority. This is something that can be corrected and fixed.
Well, hopefully today's video presentation will help with that.
I will say, the federal government compensation, I mean, Cigna's aware of this, but the Centers for Medicare and Medicaid Services, CMS, the way a physician is compensated is changing. Okay, and I don't want to steer too far away from the health of children, but I think it plays an important role in health disparities and how we as healthcare organizations respond to these health disparities. And so you have an organization like Integris, because of the way federal dollars are being allocated towards quality outcomes and improving health outcomes, you're seeing an increased investment in care coordination. For example, I mean, I don't know the exact numbers with Integris. One of some of my colleagues here may, but you're seeing care coordinators who identify high-need patients, high-need families, frequent flyers to the ER, that no doubt come from these zip codes that you're speaking of, and coordinators coming alongside them and saying, what can we do to keep you out of the ER? Not merely to save dollars for the healthcare system, but because we as healthcare providers genuinely care for your overall health. And I think this, while we're focusing on children, the health of the parents is essential, and I think you guys could identify this with the parents of all of the students. You identify this on a daily basis with the number of encounters that you have with the citizens of Oklahoma County. But if we're not taking care of the parents of these students, these children, that in effect is impacting their overall health. And when a parent is addicted to opioids, when a parent is consuming other illegal substances, that directly affects their access to a positive role model in their life that is necessary for overall development and well-being. We've kind of alluded to it in detail, and I think it plays in the healthcare disparities, this notion of adverse childhood experiences. There's significant research done in this. I think Oklahoma State University in Tulsa does research. OU has done some significant research as well. But these kiddos that have adverse childhood experiences at home, meaning we've talked about this, interpersonal violence, bullying, physical abuse, verbal abuse, these things that are taking place in the home that have a direct relationship and correlation to disease processes, functional disease process. We're not talking about just mental health, but I'm talking about hypertension and diabetes, high blood pressure, sexually transmitted infections that are associated with what was thought to be mental health related conditions or adverse childhood experiences. That's pretty profound. It means that we have to do something, and we are doing something, and it's good to see these partnerships play a role. And I think also when we talk about identifying health disparities, you're seeing certain nonprofit organizations pop up focusing efforts in specific communities. I think Crossings Church or something like that identified an area of Oklahoma City that was important and then built a clinic there and focusing on a specific area. If you look at the free clinics in the area, most of them are in areas which, by nature, I think we can all look around and determine certain elements, but technology has allowed us to identify exactly what you're talking about with zip code. And Oklahoma County, Oklahoma City is not the only place this is taking place. You can see it happening in Tulsa, between North and South Tulsa. You can see it everywhere. But I'm excited and hopeful, just like the superintendent, that with these partnerships, with teachers changing their mindset, that we are taking care of students, not merely teaching students. And when a doctor says his role is no longer to treat that strep infection when they come in the office, but he is responsible for developing a child into a functional, responsible adult, and he is responsible for caring for adults so that they can produce and create responsible citizens. And when the business community is investing in the care of their employees so that we can raise another generation of young people that become productive citizens to improve our economy in the city. I mean, it's all tied in one. And it's exciting to see when these partnerships happen. You can tell I get excited pretty easily once we get going, but it's powerful.
And just to put an even finer and more direct point on what the doctor just said, this is an economic development issue, and there is a real reason why the business community needs to care about every one of the 45,000 children that are in Oklahoma City public schools, because they're going to grow up and they're going to be in our community. And we can say all day long, well, they have bad parents, or those people. They're our people. These are our kids. And so we've got to decide as a community that we are going to put our effort here into helping and supporting these kids in whatever ways they need, because we need them to be healthy and productive.
And not just in our community, but they're our future workforce.
Absolutely.
So it's a big part of that.
Let's turn our attention to another very serious trend in Oklahoma. On many levels, Oklahoma is at the center of the battle against opioids. It's a very unfortunate trend that's spreading across the nation. It's having an impact on family and particularly on children in the household. What impact are you seeing, and how are you working together to address this very serious challenge?
Well, it is a serious challenge. I mentioned our community health assessments. We do zip code by zip code. And fortunately, in Oklahoma County, everything is a green arrow except for two areas. In other words, we're making improvement. Those two areas are, one is Alzheimer's deaths, which is a nationwide trend, of course. And the other one is unintentional injury deaths. And so when we really look at the data a little bit more closely, what we find is that it's drug overdoses. Mm-hmm. And if we go further from that, it's opioids. Mm-hmm. And so it is a very, very serious issue in Oklahoma and in Oklahoma County, and nationwide for that matter. So what we're trying to do about it is we certainly want to try to bring the community together to address that as best we can. So we did get a grant from CDC, and we put two community health workers in drug court down at the jail. And so basically what they do is they mentor, coach, and connect the folks that are in that system to community resources so that they have a successful life and a productive life out in the community. And so, we did some surveys down there. And again, you're talking about this stuff, what are the needs? And it's kind of like the hierarchy of needs, because we say, what is the most important thing that you need to be provided to you to make sure that you don't come back to the criminal justice system? We thought it would be counseling. That's what we had kind of guessed. It turns out to be housing. Mm-hmm. If there's no housing, there's like a 99% chance they're going to come back into that system again. Number two is transportation. If you're in a drug court and you need to go to counseling or services, or if you need to go get some kind of help or job or something of that nature, or to do your drug testing or whatever, then that's a real barrier. And so I think diversion programs, programs where you pull a lot of resources together to make sure that they have the things that are necessary for them to have a safe recovery and productive citizen in our community. It's a tough challenge.
Dr. Kupik, what have you seen, and what do you think could be done to address this issue?
This is the billion-dollar question. I mean, we saw this lawsuit and the settlement and stuff. I think the funds are becoming available to address this. Integris, as an institution, has committed funds, and many of you are familiar with the new Arcadia Trails treatment facility, not just for opioids, for all substance abuse disorders, which is a longer stay facility than the traditional program. So I would put a plug in for that, the additional facilities, access to facilities, yes. But I think this is an area where it does start in the doctor's office, in the casual conversations that kiddos are having with their peers. And I think a cultural shift has to happen in our society about how we deal with pain. I think this is a national problem, but here in the U.S., and I think in healthcare, and I will be the first to admit, no doctor likes to see a patient in pain, and so I've said it's my responsibility to treat your pain. And I'm not saying today that I don't want to do that. What I'm saying is a patient comes into the office, and historically that doctor has seen that patient in pain and has responded and said, in my education, I have a tool in my toolbox that will relieve you of this pain. I do that. The problem is a side effect of that tool that I'm using is addiction and abuse, okay, by nature of the way the opioid acts on neurotransmitters, the whole shebang, okay? The cultural shift has to happen to where, as a physician, my job is to reduce and control pain but not remove pain. As a society, we have to learn how to adapt, and there are newer, I think, effective things, biofeedback, other processes taking place. How can I deal with my pain in an effective way that does not cause or inhibit my activities, level of consciousness, risk to overall health? And I think that's the first that's the in-game step. How we get there is challenging, and I don't think anybody knows the answer to that. Mm-hmm. The state laws that have passed are being quite frank, somewhat controversial within the medical community. Some physicians like them, some physicians don't. I think anything, as a physician, to me, I'm saying whether there were kinks in opioid pill limits and things like this, whether there are kinks and those need to be worked out, and that's happening over time. The legislature just passed a law this year to fix some of the changes that were necessary, I think. But overall, any effort made to limit the amount of opioids that are prevalent in our community is a positive thing for me. Mm-hmm. If that means I have to do my homework and figure out how to treat my patient differently, then guess what? If I'm a committed physician and I care about the community, then I better figure it out. And so that's where it comes. That's my personal opinion. Now, I will tell you that there are varying opinions within the medical community, just like in every other profession. But my opinion is the less we can get on the in my treatment regimen, the better.
Very good.
I think in Oklahoma, I mean, the drugs are the challenges. Number one is meth. Number two is alcohol. And number three is opioids. The particular challenge to opioids is that there are more drug overdoses, so it kills more people. So it's very, very serious, but I think we have to come together, again, as a community to look at how we can take a holistic approach to this problem, both in prevention and education and in treatment as well.
So I want us to think about some of the consequences that show up in the schoolhouse now. So if I'm a child and I have a family member in my home who is addicted or abusing, a behavior typically follows. And so I am now a child who is witnessing a behavior that I have to deal with. Think of a third grader. I see an unconscious parent. I see drugs on a table. I take that with me into the schoolhouse. How do I deal with that? And so the next level there is accessibility. Okay, not only do I witness it, but now drugs, alcohol, whatever it is, may be accessible to me. And so I now begin using and take that into a schoolhouse with me. So there are all kinds of consequences surrounding abuse and addiction that show up on our doorstep, and then we do what we do. We take care of kids. But I think that this is really being magnified in our schools right now. It's not just a disciplinary issue with a child who may be misbehaving. We've got to see what it really is and then treat the root of that. It's consequences, certainly, but it's consequences with support, and we've got to be more on that support side. You know, in the old days, it was, if you're in possession, it's 45 days to the house. And while we still need to apply consequences, we've got to really pay attention to the supports that we provide our kids as well.
And that ties into our next question. We talked a little bit about the trauma training. And I know in previous conversations that we've had, Mary, we've talked a lot about, that mental health, understanding where people are within the system and what needs that they have within the schools. Can you tell us a little bit more about what you're doing in terms of identification, in terms of next steps? What do you need from all of us to help support that effort?
You want to start?
I'll get it started. So one big focus that's going on throughout the community is through the Oklahoma City Public Schools Compact. And the compact is made up of leadership from the district, from the foundation, the city of Oklahoma City, the Greater Oklahoma City Chamber, and Central Oklahoma United Way. And we've been talking as a group for a while, identifying places where this group of individuals can use their resources and focus on some of these key issues. The first issue that we took on was literacy, and we've got an amazing reading program going on called Read OKC. The second big initiative that's getting underway is called Embrace OKC, and it is designed to focus on exactly what we're talking about today, the emotional health and well-being of our children. So there's been a lot of work going into identifying evidence-based programs that are going to be put into our schools that are very customized for what the schools need individually. Because an elementary school in northeast Oklahoma City may have different issues and problems than a middle school in South Oklahoma City. So these are very targeted programs, and work is underway to get these implemented. There is going to be a big price tag attached to this, and so you ask, what can the community do? The community can step up and help us support these programs. It started out with a surveying of our kids. We went directly to the source, and what we hear from our kids supports everything we've been talking about today. They are undergoing so many adverse childhood experiences and are living with a sense of hopelessness and are using alcohol and drugs at way too young an age, and risky behaviors and all of the things that go along with that. So we've got to get busy. There are some great efforts going on, but it's going to take all of us to really move the needle on this.
You kind of answered this question to some extent already, Mary, but what advice would the panel, this is kind of a broad question, what advice would you give us, parents, business owners, voters, that could help make a positive impact on the health of children? It could be related to any of the topics that we've discussed so far, or a topic that we haven't addressed so far.
Well, I'll start. I'm sure everyone will have plenty of that. I could go on for days. I think the number one thing that I see, and the message that I try to convey, because I see this, is a lack of awareness. Gary talked about this already, but first and foremost, we have to acknowledge that this is going on. And we have to acknowledge that we cannot expect our kids to come in to school and ace the spelling test or the algebra test when they have all of these other issues going on. Yes, we need to improve academic performance, but we have to be realistic in knowing we've got to reach our kids where they are right now, and we've got to handle some of these root cause issues and help them and support them. At the same time, we are expecting high academic performance. So don't sit on the sidelines. I guess that's my overall advice. Don't sit on the sidelines. Be part of this solution, and there is a place for every community partner to plug in whatever way they can. Mm-hmm. It's very easy. Email me at mary@okckids.com, and I will hook you up.
That was good. So the way I like to break this down is just to take a class full of kids. Let's say there are 20 kids in a classroom, and to describe these kids to you. And let's just say that I invited you in, and for the entire year you got to spend every day with these 20 kids. And it was your responsibility as the adult in the classroom to take care, not just to educate, but to take care of these 20 kids every day, all school year. What I know about most folks is, number one, they will fall in love with these kids. They will want to do everything they can do to meet the needs of all 20 of these kids. So let's talk about those 20 kids. We know that right now, sitting here today, the average classroom across our school district, 1 in 4 has a parent, at least one parent, incarcerated right now as we sit here in this room. Okay? So in this classroom, I have 20 kids. I have 5 kids in that classroom that I'm falling in love with, and I want to help them. 5 of them have at least one parent who right now is incarcerated. we know that in that classroom of 20 kids, that 18 of them fall at or below the poverty line, and all that comes with that. Okay, with poverty, we know there are mental challenges because I may not know over a weekend if I'm going to be able to eat. Okay, so my meals at school are really important to me, and I don't know if I'm going to be able to eat during the weekend. So I'm the adult in the room. I love these kids, and I'm going to take care of their needs. So I will do something typically as the adult to take care of my 20. And I can give you more statistics on those 20 kids, but the point here is we now magnify that at a 46,000 student rate, because this is the average classroom. This isn't an isolated classroom somewhere. This is the average classroom in our school district where those 20 kids look kind of like what I just described. And so when we think about partners in action, when we think about supports, when we think about how can you invest, it looks different for all of us. It may be that you want to take a child and mentor a child, or a reading buddy. Or you may want to take a grade level and say at the beginning of the year, I'm going to take care of the school supplies for everybody in that grade level. Or you may say, I want to take a school. We have partners who have adopted entire schools, and they provide all through the year for the kids in that school. Or you may say, I don't know what to do. I'm going to call Mary. What was that again? And I think what we need is an affirmation that, I don't want to say that, hey, we're in trouble in Oklahoma City Public Schools. I don't think we're in trouble. I think it is a matter of reaching out to you and you saying, hey, we're standing ready. We hear that all the time. What can I do? How can I help? And us being very purposeful about getting you plugged in at whatever level you can plug in. And I think that's the important piece. It's been said a couple times. I'm going to say it one more time. These kids do not belong to the school system. These kids do not belong to a group of parents somewhere out there. These kids belong to the entire community and beyond of Oklahoma City. And so our investment becomes really important. The more we invest as a community, as an entire community, the better our return is going to be. And so I would just encourage you to do what you can when you can. And that's going to be enough. And we can really give these kids a chance.
You know, both Mary and Superintendent make excellent points. And just to follow up on the incarceration comment, the 1 in 4 parents are incarcerated in the system. The sad statistic goes on from there. 70% of those kids will follow that same cycle. And that's the cycle that we have to break. We have to come together to break the cycle of incarceration. We have to break the cycle of poverty. And how do you go about doing that? I think is a complex thing, but it's something we can all work on. I'd say first of all, as has been mentioned, is awareness, and then after awareness, it's supporting and understanding the idea that it's a complex issue that requires us to prioritize 3 things. And those 3 things are education, and we've made some really good progress last year and this year at the state level, but we still have a lot more work to do, though. And then health and wellness, because it's so closely linked in, and then understanding the connection of the economy and jobs, because that drives everything, and that's all interrelated as well. So understanding that, and then prioritizing that. I mean, all 3 of those things have to be prioritized in our state. And I'll just say this. Expanding services, health services in Oklahoma should not be a political issue. It's about kids. It's about people. It is not a political issue. We have a 14.2% uninsured rate in Oklahoma. That's contributing to this problem. We should not have, as a matter of fact, Massachusetts has a 1% uninsured rate. And so we have to figure out some way to make progress on getting health services and mental health services to more kids and to more people. Now, that's 10% of the health equation. It's not going to solve everything, but it's a necessary step, and it's a human step that we need to take for people. And then I'd say, lastly, we need to really think about partnerships, about private-public partnerships, because the school system can't do it alone. The public health system, the medical care system, even the business sector. None of us can do this alone. It's going to take all of us working together and making it a priority. Mm-hmm. But it's something that can be done.
Go ahead. Yeah.
Just echoing that the notion of funding. We have to have funding for healthcare, and it's time for people to put their money where their mouth is. We all, every Oklahoman would come up on this stage anywhere. They'll go to school. They'll talk with their friends at school. Everybody would say, I want my child to have good health care. I want to have good health care myself. If you want good health care, vote for people who are willing to invest in health care. I mean, that's pretty frank. I don't know how many ways I can put it. It shouldn't be a political issue. It is a political issue, and I'll be even more honest. Sometimes, guess what? It goes against my politics sometimes, but guess what? At the end of the day, if my excitement about that kid coming into my office doesn't translate into the way I act when I go into the voting booth, what am I doing in that calling that I believe, and I chose that path for my own life? I would say that to educators. I would say that to physicians. I would say that to every day my neighbors. We've got to get more healthcare dollars. Call your legislators. Call everybody. I mean, it's absurd. It's absurd. And then the one other point, and then I'll pass it over to you again, is not compartmentalizing. And you can see we've talked about public-private partnerships, but your child's school performance does not end in the classroom or the home. The doctor needs to know about your child's school performance, and if you don't tell them, they will not know. The teacher needs to know about your child's medical needs, and if you do not tell them, they will not know. Everything is intertwined. We like to compartmentalize because that's the way we operate as individuals and how we process things. But it's working together, it's functioning together, and if one aspect of our life is ill, for lack of a better word, then we cannot function and our well-being is jeopardized. And I'll leave it with that.
Thank you. We've got another 10 minutes. We've got plenty of questions here, but I want to give our audience a chance to ask any questions if they have any.
That Embrace OKC is the most encouraging thing that I've seen in Oklahoma City. And as a former inner city teacher, in terms of this half full, 5-10 years ago, a principal who had said the things you all said on the stage was supposed to be fired. I'm not making that up. That was in the federal regulations if you received the money. And you were supposed to tell your teachers if you wanted to say those things, you should transfer to Edmond. But I'd like to ask you guys about James Heckman, who Nobel Prize winner, graduated from Harding High School. And if you all have checked out his latest research, because he got the Nobel Prize for saying increases in test scores don't have an effect on long-term outcomes, but early education and social and emotional do. And he has found, he published last week that the children of the high-quality early education, their incarceration rate, their children's incarceration rate is 50% lower. And so it goes multi-generational. If you do the things that you guys are doing, how do we make it from half empty to half full to getting to a point where we can all make this thing a team effort?
Wow, John. John, thanks for being here. Why don't you pull up a chair up here? Well, for the educator, and I think probably for all of us, what you just said is not a shock or a surprise to anybody. And that really kind of undergirds what we talked about as far as taking care of kids. It's one thing to be a content expert, to be the very best teacher of math. But if that's where I stop, if that's all there is, then we're missing it. And so what we like to think is we're moving down that path of taking care of kids, and we're accelerating. And I think Embrace OKC partnerships that we've talked about, an acknowledgement from the doctor's office that this is more than it used to be, as you've heard. Those are the things that are going to get us there. So we would anticipate that the better we are at taking care of kids, the more likelihood of success later in life. And we will see statistics probably to follow. And I think that's a great example of it. So thanks for the research. And I think we're fully on board with that.
And I want to add on to that just slightly. Thank you, John, for all you do. There are so many ways to measure success that don't include test scores. And so, and I've spoken about improved academic performance, but I'm glad you made that point so that I can circle back around and say, don't let that be the only measure, because there are so many other measures. And school is very different now than when I was in school. You know, we're trying to teach our kids emotional intelligence and critical thinking skills and teamwork. Those are the skills that, as an employer, are a lot more important to me than how they did on their algebra test. So I'm glad you made that point.
Okay. Disclaimer. School guy up on the stage, not your disclaimer, mine. Please don't leave here saying, man, that superintendent said that testing is not important. Testing is critical to what we do. We have to evaluate and assess. That is a piece of it. How else do we know how our kids are doing and how to adjust our path unless we evaluate and assess? So it is important. I think the point I'm making and what I'm hearing up here from my colleagues is that there are other things that are equally and maybe even more important than a single window of testing in the spring across the country in all public schools. Unfortunately, we have really focused on that as far as an outcome or an output that we like to look at and evaluate a school or a kid based on that letter grade. So please understand me that I'm not saying testing is not important. I'm just clearly saying that there are other things that we need to be paying attention to as well.
Well, we have covered a lot of information in a short amount of time. This has been a very compelling discussion, and it's been a very inspiring discussion. I want to thank you for your time. If you will, please put your hands together for our panelists today. Thank you for being here, and we'll see you next time.